Hello, everybody. My name is Karen O'Donnell, coming to you from the Code Nurse YouTube channel. I wanted to introduce everybody to Code Nurse and what we are. We are a group that was created to support and educate nurses on how to become inventors, business leaders, and entrepreneurs by providing a network of nurses and healthcare professionals who have already succeeded. Our network is designed to welcome all and to support, encourage, and share ideas and stories so that we can learn from each other and move forward in our nursing journey. So I wanted to first of all introduce a very dynamic nurse named Victor Odie. Victor is a professional nurse with the Nursing and Midwifery Council of Nigeria, a certificate obtained by him in 2014. Then he became a pediatric nurse in 2017, which is very, very unusual for male nurses to become pediatric nurses in Nigeria. He has served in the national body as a preceptor for the Nursing and Midwifery Council of Nigeria in 2018 as a chief examiner. This is a position that helped score and select best nursing candidates for certification after the exam in the country. Victor volunteered for several organizations, including the International Center for Vision and Health, Docas Foundation and Nursing World of Nigeria. He completed a certification from the University of Washington in 2020 and was named the best nurse in University of Port-harcourt Teaching Hospital in Nigeria in 2020 by the Association of Resident Doctors. He worked with Dr. S.L. Harcourt, who exposed him to orthopedic surgeries and protocols and helped complete more than 20 back surgeries in 4 years. He is currently the Pediatric Emergency Unit of the University of Port-harcourt Teaching Hospital as a pediatric nurse, and he is a first responder. And as an entrepreneur, he is currently leading healthcare business, especially in emergency response service. Personnel innovative business idea conceived COVID-19 wave. He is also grateful for the support of Odit HN, a colleague and a mentor of his in nursing. She contributed greatly to his many nursing accomplishments, and her memory will continue to fuel his present and future nursing accomplishments. So Victor, thank you so much for being a part of this. Welcome.
Thank you so much, Karen. I'm so happy and excited to be in this program today. You guys are really doing wonderful, wonderful programs for nurses out there. And I'm so excited to be one of those you've chosen to see what he's doing. And I'm glad that I'm here today. Thank you so much. Thank you so much. And how are you today?
I am doing very well, Victor. Thank you. So you have had an amazing nursing journey. Tell me a little bit how you got started.
Oh, thank you so much, Karen. I need to say this. Thank you. How I started my nursing journey. All right. I started in 2011. But before that time, I have had a colleague, but then she wasn't my colleague. She asked me to come into nursing, and then I actually decided to, and that's because I saw a few things that her mom was doing as a nurse. So we could actually go there, look at the maternity and then the patients that she had. And so we could go look at the patient, maybe bring her some supplies, bring her some BP apparatus to use for the patient, ask questions. You know, it was all interesting to actually see the whole thing she was doing for her community, which was my community. And I saw the love and the care she gave to people and the hope everyone always had when they want to come visit her. I also saw the hope that she gave to the people, the smiles she passed across to people. And I told myself that this is really an interesting thing to do. And so when it was time for me to choose a career, it wasn't really difficult for me, although I really wanted to become a medical doctor to also care for patients. But with all that she did, and then my friend and colleague being around me and asking me, you can actually do something as a nurse. The one of the days I walked into a hospital only to see her elder brother too doing
Oh,
nursing. So it was a mother, a younger sister, and a brother. Oh, I said no. I think I need to give this a shot. And that was just the whole of the motivation to actually get into nursing. And ever since then, I have actually enjoyed my career as a nurse. Uh, if I've done so much with nursing. Nursing has exposed me to a lot of persons, a lot of care. During the Nurses Week, I told someone that one of the things that kept me going, or that have kept me going in nursing, is the fact that the patients that I care for also care for me.
yeah.
Yeah. The smiles that they put out there for you when you give them care becomes a source of joy for you. So somehow you care for them physically, they care for your mental health. And that's amazing. That's how amazing nursing is, that you're doing something very wonderful, very beautiful for people. And you don't also know, if you're not careful to notice, you won't see that they also are caring for you, because the smiles you see on their faces when you go back home, you're so happy, you're so fulfilled that yes, you've done something for the day. Thank you very much, Karen, for that.
That is the epitome of nursing. It definitely is. And, for anybody who is just going into nursing and is not sure of whether or not it's the right thing to do, just listening to the passion that you have about what you do and being able to care for people is a gift. It's a talent. And it's not,
Yeah, absolutely.
it's,
It's a
um,
talent.
yeah, it's a calling, and it's not just for a paycheck. It is to make yourself feel that you are doing something for other people by just being there, by holding, sometimes just by listening. And I think that, it is amazing to be able to care for somebody else and to be
Yeah.
up close and personal. And their smiles are infectious, just like yours.
Yeah, really, really. Oh, thank you for that. I remember something way back in 2014, um, when I finished my first nursing degree. I decided to keep volunteering for organizations. I mean, even as a student, I was doing a whole lot for the community that I was in. Could
Yeah.
go on, invite, do I care for people, get to organize a lot of persons, just to see that the nursing I want to start after I've graduated should start as a student. So we did so much for the community that we belong to, that the community still recognizes us several years after we've left school. You could
Wow.
go to those places and they see you, they still know you, they still know
Yeah.
the things that you have actually done for them. And it's quite fulfilling to have to do something for a community, and to put smiles on their face. And you see this longevity you still give to people in
Yeah.
spite of their inability to provide themselves first-hand care, health care, and all that. So we're able to do that in our communities, even as students. So, riding as a nurse after my career was really very beautiful for me. I actually knew what I wanted to do, even as a student. So I came out and then I was just doing it.
Yeah.
So that's
Yeah.
that's the beauty of nursing and what we're doing today.
Yeah.
Thank you.
So tell me a little bit about your community outreach emergency response program. So you decided that you were going to become a little bit of an entrepreneur, and you your own first response service. Tell me a little bit about that. That's amazing.
Yeah, really very amazing thing that happened to us. My idea was conceived from the COVID-19 wave. It went all unnoticed. It went all unnoticed until the COVID-19. That was when I sat down to see a whole lot, and I beat my chest and told myself I need to stand up to and take up responsibility for the community where I belong to.
Yeah.
Now, what did I notice? What was the gap? I actually found out that there was no good emergency response services in the entire state.
Wow.
And that really bothered me. During the COVID-19, there was lockdown everywhere. People didn't get Medicare. People didn't have money to even call into the hospitals to send their ambulances across to come get them.
Yeah.
And so people were dying. In fact, people didn't just die because of the COVID-19 alone, but these are people who would have had other diseases and missed COVID-19, right? And they could not also access the healthcare. They could not come to the hospital. These are people, you could talk about people, primary gravidas that should be monitored even in the hospital earlier before, they are supposed to put to bed and all that. And it was really difficult for them to get into the hospital. Nobody could come to the hospital. And I saw that as, in fact, I saw it as an emergency to start up the response team. And then I had to quickly get some people who would actually help. So for me, basically, it was an observed gap out of the COVID-19. And we actually sure that the world has really changed from what it used to be to what it is now. So I felt it was time for my community to actually see something that is going to be better. So that was how the idea actually started,
Wow.
and I'm glad that that idea actually popped up at the time it did.
Yeah.
Thank you.
Where are you at with your business at this point? Are you almost at the point where you can actually go and transport patients?
Oh, thank you very much. We are actually at that point where we should transport patients, just like I would always tell people. When you observe a gap and you see how urgent it is, you want to do everything to make sure that it comes to be.
Yeah.
you organize your team, you get your protocols ready, you get a whole lot of things ready. Then the next thing you're faced with, something just confronts you and tell you actually need funding at this point in time.
Yeah.
And then you now come back to your drawing board with your team to begin to re-strategize on how you're actually going to raise that. We are actually ready to go live, to start transporting patients, to
Wow.
take patients to where they are supposed to be in. We're actually ready to do that. All we are waiting for is for ambulances to be ready. With ambulances ready, we are going to be able to start doing that. The team is ready, the human capacity that are going to execute this are ready. And then the website ready, campaigning from the underground. But we actually have found out that once you open up the service to people, they are going to be calling in. And if you don't have any ambulance to offer to them immediately, it's going to be difficult. So we have told ourselves that all we don't even need money for the ambulance. No, we just need the physical ambulance. Once the ambulance comes, we can tell people this is our numbers. You can start calling in. We are ready to come pick you. We are ready to do things with you and all that. Initially we actually wanted to run this as a foundation, but we have found out that it will be important that somehow a few things will be serviced. So that's why it is actually going to be at a very affordable rate, knowing fully well that we are directly dealing with life. And we actually have strategies on how we are going to do this. A lot of persons will always ask me, what do you think healthcare in Nigeria can become? How do you think you can run it? I told them that a few things I can do to make sure things work. And I told them I'm going to start implementing them in my place. One of the things we can actually do is to have people who can sign up for premium, for monthly ambulance services. it's actually an emergency service. They may not need those emergency service at those points in time, but because they already have a premium running, it could be serving some other people who would need it. It could be serving some other people who would need it. And so we will do very well as a people, to use what's available to serve those who are there, at that time. And when the people who will need it later will actually require it, immediately they also get it. So because of the strategies we have put in place, it is possible for us to be able to achieve all that we intend to actually achieve. But what we need is a capital investment of ambulances here and there, and then we can actually start running. Human capacity is ready, website is ready, phone numbers to call in are ready, because these are basically the things you need. They are all ready, and we hope that the ambulance will come very soon so that we can start giving services to the people. Actually, that's where we are. We're actually at the point of bringing in an ambulance.
Wow.
Thank you.
That's great. So what I think I would like our audience to know is that they can contact you on LinkedIn, Victor Odie. And at this point, I think probably in the near future, you'll be able to share your website once you get your ambulance. I definitely encourage all of our nursing community to reach out to you to offer any type of support.
Wow, 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 wow.
That's what it's all about. Nurses need to try to support each other, and it's one big nursing family, and we are all in this together to try to help as many patients as we can and to do the best we can in our nursing profession. So I think that what you're doing is amazing, Victor. I really hope that we can get you an ambulance in the very soon future so that you can get your program started and you can start helping and saving more people.
Yeah, thank you very much. Karen, I want to mention this, that right now we already have collaboration with a whole lot of other business outlets, and somehow we are directly stakeholders in those places. Let me say this. I have a friend. She is actually passionate about blood drive. And she began to look into sickle cell diseases. I mean, it's really prevalent in this part of the world because of lack of awareness, and all that. So you still have people living with sickle cell in the community and all that. So she began to do a blood drive program and all that. And the bloods that were collected, we also saw that it was not just serving the sickle cell patients, it was also serving the entire populations. Let's take, for example, like I told you, I'm a first responder. So every child who comes in into my unit first. So I've personally donated blood to these children, screened my blood in our blood bank, did all the serologies and all that, and then saw that I was fit and the blood could go, and then the child received the blood. I wouldn't have been able to do that if I didn't understand how emergent those things should be, how much I was supposed to actually respond to that child. And so with our collaboration, I found out that we could do some of these things for people, make sure that people get exactly what they need to get at a snap. All you need is calling the ambulance. We need blood coming into this place, and our collaborative effort in making sure the patient gets well will be to get blood bank here, so the emergency service is going there to get the blood and then bringing it to the. So it's not just about the patient that we are going to be transporting. We are going to be transporting healthcare materials that will be pertinent to help this patient.
Yes. Yeah.
Yes. So we are actually moving this whole thing. I also have a friend who is doing eye care. And so I told him, hey, even when we are going to be needing your services, I hope you'll be ready to. He said, absolutely, I am going to really be supporting you. In fact, when people view my status most recently, they will see me making some campaigns for the eye care and all that. So we're just reaching out to ourselves to see how we can build a healthy community, you know, in where we have found ourselves.
Yeah.
So that's justice, Karen.
That's great. That's great. It's true. We all need to work together because most patients are very complicated, so they don't just need one thing. You're absolutely right. There's a lot to each patient care. So again, I really recommend that everybody reach out to you and offer their help and support. I think that in the future, let's do another interview so that we can find out where you're at with your campaign and with your program, so that we can continue to try to support you as best we can. Okay?
Thank you very much. Absolutely. I want to promise you something, that once the ambulance arrives, I'm going to tell you, I'm going to thank everyone who made it possible. In fact, I'm already saying thank you from this place, because I am very optimistic that the ambulance service is going to be running very soon from all of our efforts, trying to make sure that patients somewhere down here in Africa begins to receive optimal care. And I'm going to be really grateful. And I'm also, to the people who are going to be investing, bringing ambulances, because that's basically what we want. We don't want money. That's the truth. We don't want money. We just need an ambulance. We just need an ambulance paid for, running on the streets of Port-harcourt. And then, Karen, I want to say a very big thank you again for this. I mean, you're doing a great job out there. I must say, you're doing great for nursing. You're doing great for the community. You're doing great globally. Look at you reaching out to Africa. This is one program that maybe you conceived thinking that is something that will serve your community. See, it has gone beyond your community. It's going wide. I must thank you for this. I must thank your team. I must thank your nurses for what they are doing. And I'm so very thankful for this opportunity.
Absolutely, Victor. I am really glad that you were a part of it, and I hope that we can continue this conversation in the near future, and you can tell me how everything's going at that point. Okay?
Absolutely. Absolutely.
All right. Have a great day.
Absolutely.
Talk to you soon.
You too.
Right.
Yeah, thank you very much.
Bye-bye.